it's Jessica DaMassa for HIMSS TV, and joining me right now I have Emily Hine. She is the Vice President of Business Development for Meru Health, and that is an online clinic that helps people with depression and anxiety, and you guys are targeting physician burnout.
Yes, we are.
Okay, so talk to me a little bit about this. This has become such a hot issue over the last couple of years with a lot more visibility brought to it,
Right.
A lot of people talking about it in this space. So what are you guys seeing?
Yeah, so the big thing that we're seeing is that depression and burnout are really two sides of the same coin, and so we actually treat both. And for example, physicians might more identify with being burned out, whereas at home you might identify with being depressed. But the rates of depression, the rates of burnout are skyrocketing so high that we need some digital solutions. We need scalable solutions that can actually help interrupt the pattern for someone so that they don't spiral all the way down to the point where they have suicidal ideation, which is what we're seeing. Physicians are the #1 profession that commits suicide, and that's unacceptable. So we're working to interrupt that downward spiral, not only for physicians, but really for anybody who's suffering from depression and burnout.
Okay, so talk to me, I guess, about interrupting that downward spiral.
Yeah.
Like, what exactly does that mean, and how are you interrupting it?
Yeah, great question. So, for example, oftentimes our thoughts are what are causing our downward spiral. And so in our program, which we have an online medical clinic, it's a 12-week program, and people go through it, and it includes things like cognitive behavioral therapy, mindfulness, behavioral activation therapy, sleep, and nutrition counseling. And throughout the 12 weeks of the program, people are learning skills that help them interrupt that inner critic voice, that help them become more mindful of their surroundings, that help them actually make life changes, lifestyle changes, and to make choices in life that are based on values. So it's a pretty complex research-based protocol that's been scientifically proven to heal depression and prevent relapse. And so really it's about empowering the users with the tools that they need to heal themselves so that when life's inevitable ups and downs come, they actually have the tools that they need to deal with them instead of spiraling down.
Can you give me an example of like these tools that you're working on developing as a result of the program?
Yeah, so we actually already have it. It's already been launched, and we're using it in lots of different places, from medical care facilities for physicians to employers, et cetera. But they use their smartphone application.
Okay.
And the first week they might have an introduction to mindfulness, just as a baseline for understanding, okay, well, what's happening for me? What's happening in my mind? What's going on in this vortex that can sometimes take me down? So the first week they might learn basics like body scan, that kind of thing. The third week we're looking at the inner critic.
Okay.
What's happening with the inner critic, and then how do we bring in some self-compassion sort of as the antidote to that perpetual voice that most of us picked up when we were young and haven't yet dropped it, and that can actually take us into that downward spiral.
Within the physician population, I mean, one of the things that is challenging for them is their schedules and how busy they are. And I know, I mean, putting a technology solution like yours into play is nice because they can do it whenever they want, but 12 weeks, and I mean, how engaged are you on a daily basis with this?
Really, really important question. And we were concerned as well about the physician population, but we did a pilot study with a group of physicians in Palo Alto, and what we found is they had higher engagement than our general population.
Really?
96% of them completed the program, and they were practicing on average 5 days out of 7.
Okay.
So this is a population that's highly educated, and they are motivated to be well, right? Because they want to be of service and help others become well. The other piece I think that's really important that I haven't mentioned yet is that our solution, being that it's a digital solution, is discreet. So a lot of physicians in particular don't want to get care because they can't have anything on their record that says I'm suffering from burnout or depression, because it could impact my caseload, it could impact my employer for that matter. And so we want to provide them with a discrete solution that they can do in the privacy of their home or their workplace. But the important thing is they do it. And so the physicians who've gone through the program, higher completion rates and higher practice rates.
Who knew that doctors made such great patients?
They're motivated. They're motivated.
You could see that for sure.
Yeah.
And so you have launched this out to the general consumer population. And so what kind of feedback have you gotten?
Yeah, so we actually sell directly to other buyers. So for example, large employers and healthcare facilities. So we don't sell directly to consumers.
I didn't mean that. I meant like you're out there with consumers using it.
Yeah, absolutely. So we're getting great feedback. For example, there was one woman who, her name is Mary, and she works at a high-tech company, and she had been suffering from depression for about 10 years. She was 55 years old, and she had been trying meditation off and on for 10 years. She'd been trying a lot of different things, and she was very skeptical about our program. And at the end of the day, she wrote us this great testimonial and said, you know what, I was wrong to be skeptical. This has absolutely helped me. We've helped people get off of disability
Really?
Yeah, and we have had physicians who've gone through the program who said, this is better than any of the other sort of mindfulness-based protocols that I've gone through before in a face-to-face environment.
Is there one thing that they pick out as like as the thing that makes it so much better?
I think a lot of them really like the group support. So there's an anonymous peer group, so you actually don't go through it alone, which is super important for depression and burnout, because we already have so much stigma and shame associated with mental health issues, and it's like, that's so unnecessary because we all deal with it at some level. But here's what they love is I'm going through it with my peers. They're anonymous, they've all got avatars, so I don't know who else is going through it, but I do know that other people have a self-critical voice. I do know that other people are struggling at work. I do know that other people are looking for solutions to heal. So the peer group is huge, and then the other piece I think that's really important, and we've had physicians tell us this, is our licensed therapists.
Okay.
Everybody has access to a licensed therapist through the program and a psychiatrist, and so they're never alone. If a bigger issue should come up, they can private message their therapist and really get support on those days that they need it the most.
This is so exciting. I think it sounds like a great solution. I have to check it out. So it's Meru Health.
Yes.
Okay, and it's spelled MERU, right? Okay. So everybody can check that out. Thank you so much for joining us. This is such an important issue right now, and really admire the work that you guys are doing to help kind of bring a tech solution into this space.
Thank you so much for having me.
Yeah, no problem. Thank you. I'm Jessica DaMassa with HIMSS TV at Health 2.0. Thanks for joining us.